Excellent points. Thank you very, very much. Good testimony. Our last but not least witness is Dr. Sterling Ransone, his family physician from Deltaville, Maryland. He's testifying on behalf of the American Academy of Family Physicians, one of the largest national medical organizations at the center of our healthcare reform discussions, with more than 94,600 members in 50 states and territories. Welcome to the committee, sir.
Thank you, sir. Chairman Schrader, Ranking Member Buchanan, and members of the Subcommittee on Finance and Tax, I'm Dr. Sterling Ransone, a practicing family physician from Deltaville, Virginia. I'm here representing the 94,600 members of the American Academy of Family Physicians. I'm pleased to be here today to support the Small Business Health Information Technology Financing Act. Congresswoman Dahlkemper's bill goes a long way in helping family physicians adopt health information technology, or HIT. To give you some context, let me share with you some information about the AAFP in family medicine. The AAFP is the only medical society devoted solely to primary care. Nearly 1 in 4 of all office visits made to physicians are made to family doctors. This is 208 million visits each year. In our fragmented world of healthcare, family physicians treat the whole person across all ages. Due to the number of patients that we see each year and the wide range of medical services we provide, the AAFP is committed to HIT as one way to improve quality and cost effectiveness of healthcare in the United States. H.R. 3014 would be a welcome adjunct to the provisions contained in the Recovery Act, which passed last February. The AAFP worked closely with Congress to craft the Recovery Act provisions on HIT. The law makes an unprecedented investment in HIT, and it reflects an understanding that HIT is critical in any reformed healthcare system. However, the Recovery Act funding does not contain a crucial piece that this bill provides. That's access to upfront capital for physicians seeking to purchase HIT systems. We appreciate that H.R. 3014 includes guarantees for loans to physicians and practices and helps providers using HIT to improve care and help patients. We also appreciate that this legislation recognizes that solo, small, and medium-sized physician offices still find it difficult to afford health information technology. While everyone benefits from these HIT systems, the physician bears the cost of acquiring the system and implementing it in the practice. Unfortunately, primary care practices are seeing declining reimbursements and increasing operating costs. This has severely restricted the access to capital to invest in HIT. Right now, about 1/2 of family physicians are using electronic health records, and we are proud of that fact. Nevertheless, based on an August 2008 survey, the other half said that cost was the most important reason that they were not adopting HIT. Let me give you a personal example. I've got a friend in solo practice in Richmond, Virginia, who employs 1 nurse and 1 administrator in his 3 exam room office. Since my physician friend is aware of the benefits of HIT, he undertook a serious review of the available electronic health records to find one that would fit his practice, was affordable, and appropriate to use. Unfortunately, despite his due diligence, he came to the reluctant conclusion that as a small business owner, he simply could not afford to make that investment. My friend is precisely the type of small practice this bill would target. Let me close with 3 other points. The specifics of the Recovery Act are still unclear, especially the definition of meaningful use. Loans such as these in H.R. 3014 could at least help physicians determine how they'll pay for HIT. Meeting the eventual meaningful use requirements and staying current will mean both time and money for family doctors. Consulting, training, and workflow redesign must be considered in addition to hardware and software issues. These are going to be ongoing costs for each physician. Last, a streamlined application process with minimal paperwork also will be key to attracting the busy physician in solo, small, or medium-sized practices. We ask the other witnesses at this hearing to develop applications that are as simple as possible. Healthcare is a significant component of our economy. Our committees are working right now to pass healthcare legislation that will improve quality and cut costs. We appreciate that H.R. 3014 will help physicians to adopt HIT, which is an essential component to any quality improvement initiative. While health information is only one portion of this highly complicated industry, investment in HIT at the practice level is critical to improving the health care of our patients. It will reduce costly medical errors. It can help patients manage their health care more efficiently and will contribute to the nation's economic recovery. Thank you for this opportunity to testify.
Thank you very much, Doctor. Appreciate your coming and quality of the testimony